former President Joe Biden has been diagnosed with prostate cancer. According to a statement from his office on Sunday, the president was evaluated last week when doctors found a new prostate nodule after experiencing increasing urinary symptoms. On Friday, the 82-year-old former president was diagnosed with cancer that has spread apparently to his bones. The statement said that while this is a more aggressive form of the disease, the cancer appears to be hormone sensitive, allowing for what they called effective management. The president and his family now reviewing treatment options with doctors. And joining me in Studio B this morning to talk more about that, Dr. Ravi Patel with Comprehensive Blood and Cancer Center. Dr. Patel, thank you so much for coming in this morning to talk, because everyone is talking about this right now. First of all, just the diagnosis itself. Many people, you've heard the stage 4 in there. Explain what that means for people.
In general, stage 4 means that the cancer is spread to other parts of the body.
Okay.
But different cancers behave quite differently. So certain cancers are extremely aggressive. If you take a cancer called small cell lung cancer, very rapidly growing. Prostate cancer is also aggressive, but there's a lot of options. Again, stage 4 means it's spread to other parts of the body, but there are other treatments which can be used to prolong the lives of patients who have what is called metastatic prostate cancer.
So in the past, hearing the words stage 4, everyone thinks of it as a death sentence. That's not necessarily the way it is now.
No. And particularly for prostate cancer, there's a lot of different treatment options. Prostate cancer is driven by the male hormone testosterone. And that's like adding fuel to the fire. So, you know, if you suppress testosterone, you can control prostate cancer reasonably for a period of time.
What type of treatment options would you think that they're recommending right now for the president? I mean, obviously, you're not looking at his charts, you're not looking at his information, but what are the type of things that they would be telling him?
So surgery would definitely not be an option, because you can't remove something when it's spread throughout your body. So you come up with a treatment which works throughout the body and keeps things in control. And that kind of treatment is, in prostate cancer, is called hormonal therapy. And prostate cancer is driven by the male hormone testosterone, and if you suppress the testosterone, you can control it.
For everyone else, when you're sitting back and you're thinking about this, obviously as you begin to age, you should be getting these types of tests and everything. What is something that you can do to check for prostate cancer?
Very easy. Your primary care can do a simple little blood test called the PSA, and it's a good idea to get the PSA done at the age of around 45, and most of the primary care physicians will do that, and that's
on an annual basis.
On an annual basis.
And then beyond that?
And then beyond that, also it's important that you get the checkup done, or every year when you get your checkup done, they'll do what is called a prostate exam to make sure, the most uncomfortable one, to make sure that they don't feel anything in the prostate. Because just doing the blood test and not doing the exam, not a good idea. It's a combination of both. And
then just real quickly, the thing that really kind of touched on me too was just food and diet.
Very important. Mediterranean diets are very good ones. Lots of fruits, veggies, berries, all of those reduce a variety of cancers and are also generally good for prostate cancer.
Very good. Dr. Ravi Patel, thank you so much for coming in this morning. We appreciate you sharing your experience with us.
Thank you.